Hello, my name's Brooke Ward. I'm the President and CEO of the Washington Health System. It's my honor to be back with you again for our ongoing Friday video series where we attempt to update you about what's going on in healthcare and what's going on in our health system as well. All of my updates today are going to be related to COVID, and the vast majority of them related to the vaccine. For other information about our visiting policies, testing sites, etc., you can go to our website, WHS/COVID, to learn more. So let's get right into the vaccine process and the updates today. Right now, as of Monday this week, we had about 16,400,000 individuals across the U.S. who have tested positive and been infected with coronavirus. We've had over 300,000 deaths, and hospitalizations continue to be on the rise across the nation and at the Washington Health System as well. On Friday, December 11th, the FDA met and approved the emergency use authorization of the Pfizer coronavirus vaccine. The first vaccine was given at Long Island Jewish Medical Center Monday this week to a healthcare employee, and it continues to roll out across the U.S. We're fully expecting the FDA to also approve the Moderna vaccine this week, which will also help. So one of the questions I've been getting is, when will Washington Health System get the vaccine? We're scheduled to get about 2,000 doses next week, and we're going to follow the CDC's tiered distribution process for who gets the vaccine, starting with phase 1A, which includes healthcare personnel, individuals who live or reside at nursing homes, and other individuals in long-term care facilities. So we're going to start that next week, and we're going to roll that out not only to people who work in healthcare who work for us, but other individuals who work in healthcare jobs across our communities. So from our perspective, this is a community vaccination event. It is not solely a Washington Health System vaccination event. We're following the CDC's guidelines that came out of the Advisory Committee for Immunization Prevention. Now, for our employees, the vaccination is going to be voluntary, at least for now. We may change that later, but we're not making it mandatory to start. Now, we get a lot of questions about when will this be available to the general public, and that's going to take a while. There are about 25 million people across the U.S. who work in healthcare. On top of that, then you have phase 2. Phase 2 people are basically individuals who are over the age of 65, individuals who have underlying health conditions that would make them more susceptible to coronavirus, and other people who are in essential jobs. So we have to hit phase 1A first, those people I talked about. Phase 2 I just talked about before we get to the general public. That's going to take a while. And in that last phase, it would be all Americans who are under the age of 65, who don't have an underlying healthcare condition and are not in a healthcare job or another essential job. So it's going to be a while. The federal government's predicting that will be somewhere around May or June. And that's assuming everything goes well. It could be longer, but we're going to be rolling out as quickly as possible. In the meantime, we've had a number of people calling already trying to schedule an appointment, and we're not ready for that. As I said, we're working through phase 1A healthcare employees. So it's going to be a while before we're ready for the general public. We'll let you know when, and then you can call and schedule an appointment. I've also been getting a lot of questions about whether or not the vaccine is safe and effective. The FDA, as part of this, did a double-blinded placebo study of 44,000 individuals, and they found that the vaccine is 95% effective in preventing serious illness due to COVID and 100% effective of eliminating hospitalizations due to COVID. So it does work. In addition, they determined that it's safe. There have been no long-term or serious illnesses. Now, we all have to admit, it hasn't been around long enough to know what long-term is, but we do know that there are lots of people who've been infected with COVID, have gotten extremely sick, and have long-term effects. And so we know there's serious damage on that side. But it appears right now the vaccine does not cause that and will be safe. There are mild side effects, which I'll talk about in a second, but they do seem to be mild and they resolve quickly. Now, I'm confident at this point the vaccine is safe and effective, and when it's my turn, I'm not going to cut the line. I will, in fact, get the vaccine personally. I think it's safe. I'm going to get it. I hope you will as well. Now, let's talk a little bit about the side effects. I've been getting a lot of questions about what they are, how bad they are, those kind of things. And what we know from the data so far is about 50% of the people that get the vaccine have a small, mild side effect, usually after the second dose. That usually consists of a mild to moderate pain at the injection site, fatigue, headache, and sometimes chills. And so it feels like you might have COVID or the flu during those couple days, and it might be uncomfortable. Now, what's important to remember is That happens with just about every immunization. There's a percentage of the population that have that kind of stuff. It's the natural body reaction to having this injected. It means your body's creating the antibodies, which is a good thing. It's also important to know that it takes about 2 weeks from the time you get the injection until the antibodies get created to help defend yourself against COVID-19. And in the meantime, you could be exposed to COVID and develop COVID-like symptoms. So the vaccine is not a live COVID virus. It cannot cause COVID-19. But I know there's going to be some individuals who either feel ill following that as a reaction to the virus or the vaccine, or they actually, by total happenstance, got COVID and the symptoms developed after they got the vaccine. So we just need to keep that in mind. And we don't need to be confused about the fact or have people tell us that the vaccine causes COVID-19. That is not true. It is not happening. Again, so the symptoms from getting the vaccine are mild and they usually clear in a day or two. Now, we're also getting a question from people, if I've had COVID-19, should I get the vaccine? And the answer is yes. Here's why. We all know if you've been infected with COVID-19, you have an immunity from it for some period of time. But no one knows at this point how long that's going to last. And in the Pennsylvania Department of Health, they consider that protection to last about 90 days. After that, if you get exposed, they believe you could be reinfected. So getting the vaccine is going to be important because that's going to provide you an immunity that lasts much longer than 90 days. It doesn't mean you need to be first in line, but if you've had COVID-19, you should get the vaccine. And again, as you heard me say in a prior video, I was infected with COVID-19 and I myself am going to get the vaccine when it's my turn. The other question I keep getting is, once I get the vaccine, can I stop wearing my mask? And unfortunately, the short-term answer is no, you would still need to wear your mask. And here's why. The FDA studies basically proved that the vaccine was effective in eliminating getting seriously ill or having major symptoms of COVID-19. What it did not do, and we don't know yet, is can you still be infected, asymptomatic, and a spreader? And so we all have to assume that after we get the vaccine, even though we're immune, we could be a spreader. Now, I know the researchers are going to be looking at the rollout of the vaccine and tracking this closely. So hopefully we'll know later this year whether that's true or not. But in the meantime, we'll have to all continue to wear a mask. It's a small sacrifice to pay to keep our loved ones, neighbors, and friends safe during that period of time. So I am sorry to give you that bad news, but that is the reality where we are now. I'm also getting questions, when will we return to normal? And that's hard to say as well. What we do know, as I said earlier, is it's going to take a while to get through the vaccination process for phase 1A, phase 2 folks before we eventually get to the general public. And we're not going to be able to return to normal until we get the vast majority of the public vaccinated. So it greatly depends on how quickly we can get them vaccinated and how many people are willing to get vaccinated before we can return to normal. So I hope it's in fall of 2021, but none of us really know at this point, and it's going to be a while before we will know. In the meantime, we all need to remain diligent. That means we need to continue to wear a mask, social distance, no gathering in large groups, continue to hand hygiene, all the rules and things we've been trying to do for these many months. That also means this December, during the holiday season, we need to do what we talked about around Thanksgiving, which is none of us should be gathering in groups with people to celebrate the holidays or to celebrate anything outside of the people you live with full time. I know that's difficult during these times. We all want to get together like we have for decades with our family, friends, and loved ones. But one meal, one gathering, one social event is not risking the lives of your friends and families. And so I would encourage you, please avoid doing that here this December. Let's get through this. Let's all get the vaccine. Let's get ourselves back to normal, and then we can celebrate with our family and friends. Hopefully you found this video helpful. I thank you for taking the time to watch it. I hope you have a safe and happy holiday season. Our next video will be on January 8th. We're going to go out 3 weeks because of the holiday season, but we will be back on January 8th. Until then, stay safe.